Katzcradul here. I made a run to one of the big box stores last night to get some supplies. These weren't actually the supplies I was going after. I was going to get some other things. But I decided while I was there, like I always do, that I'd pick up a few extra first aid supplies. So I bought 3 small boxes of triple antibiotic, 3 boxes of butterfly wound closures, 2 packages of heavy-duty first aid tape, 1 box of an arthritis rub, and 1 bottle of a botanical-based insect repellent. I consider that first aid because if I use that, then I don't have to find other kind of creams and ointments to put on bug bites. So, I mean, at first glance you would say, well, that just hardly seems like very much of a first aid stash there. But I want to show you my first aid supplies that I have accumulated over a year's time. And this is what I do. Almost every week I add to it just a little bit. And what you're looking at here is probably not more than about $20 worth of supplies, which I'm able to take out of my weekly budget to add to my stash. So let me show you what I got. Alright, we're in one of my spare bedrooms now. I used to think my home looked like something that came out of the magazines. Everything was in its place, everything was decorated nicely, and I guess I took a lot of satisfaction in that. It doesn't look like that anymore. And I'm happier and more satisfied, really, than I've ever been, because I know I have the things I need to take care of my family. This is stored. I have a day bed in this room. This is kind of stored behind the head of that day bed, and you'll see lots of things like the oven that goes with my kerosene lamp, a little Coleman stove that fits on the propane bottles. There's a windshield reflector thing that I'm going to build another solar oven out of. There's an extra fire extinguisher, an extra heater, just all kind of stuff. And then you get over here, and I've got this little yellow chest that my mother gave me. It was actually mine when I was a baby. I used it for both of my children, and now I'm using it for first aid storage. And on top of it is powdered eggs and something else from Honeyville, and some seal meal bags, another case of seal meal bags up here. So let me just show you what I got in here. And it may seem like there's no rhyme or reason here, but I know what I have, and that's what's the important thing. So I just open up this drawer, and in this drawer I've got, and I'm going to tell you what I have just in case you're thinking, oh yeah, I probably should get some of that. I'm not saying you should have any of this stuff. I'm just saying this is what's right for me and my family, and you can decide if it's something you need. There's odorless garlic and cayenne I both take during cold and flu season. Here, this little section right here, these 3 things are for taking care of my daughter who tends to have ear problems and earwax buildup problems. So here's a little kit to get wax out. Here's sweet oil that will soften the earwax. Here's prescription earwax medicine. Here's something I think is very important if you don't have it. Things to flush out eyes. This is called artificial tears. It works great to flush foreign debris out of your eyes. This is probiotic acidophilus. I would use that if I'd had a long run of diarrhea and was trying to build up the good germs in my gut. Love that acidophilus. I have some more of that in another room. Here is 81 milligram aspirin, low-dose aspirin. A lot of people take that. We do too. I have lots of glucosamine chondroitin, the complex. This one is with vitamin D. I have a joint problem in my knee. I have lots of glucosamine stored. You can refer to my egg video where I talk about grinding eggshells. That's another way to get collagen that helps build that cushioning in the joint. Saw palmetto, that's for men's health. You can read about that and find out what that's for. I've got some vitamins for teens because I've got a preteen. And then I store lots of these little bottles of extracts and oils. I have a lot of echinacea. I have a couple of bottles of tea tree oil. That's really good if you're fighting some kind of fungus under the nails or that kind of thing, and if you were working outside for an extended period of time in wet or damp circumstances, that is a real possibility of some kind of fungus, especially if you didn't keep your feet dry. So love tea tree oil. Lots of applications for that. It's a wonderful thing to have. Okay, here's the next one. This is over 50 vitamins. I hate to admit we're in that category now, but it's true. Oh, here's potassium iodide. If you don't know what that's for, you probably should look it up. More glucosamine. Tubes of Carmax for my daughter and I are both prone to getting fever blisters and ulcers and that kind of thing. Vitamin D. I always take that when I start back to school. Really helps boost the immune system, and there's really kind of a switch from everybody saying, oh, vitamin C when you're sick, to actually vitamin D. So we've kind of gotten on that bandwagon as well, and it seems to help. Lots of glucosamine, lots of ibuprofen, Tylenol equivalent, which is acetaminophen, another big bottle of ibuprofen, lots of that. I have it stored everywhere. Some bottles of antacid. This is all allergy relief stuff right here. There's one right there so you can see. I buy a lot of my non-prescription things if I can at Aldi. That's a good price on allergy medicines, acetaminophen, ibuprofen. I like this Equate headache relief. That's the equivalent of Excedrin. It's pretty much the only thing that'll work on my headaches, which I don't get very much, but I love to have that. I also buy this at Aldi. I store a lot of it. Antidiarrheal. You need to know how to take this stuff, though. If you've gotten some bad food and you have diarrhea, you do not want to take this right away. You want to go ahead and allow yourself to get rid of that, the bug or the germ or whatever, for about 48 hours, and then you would start this. So be sure to know how to take an antidiarrheal, or else you'll do yourself more harm than good. Okay, that's that drawer. Go on to the next one. Third one down. Let's see what we got in here. Lots of cinnamon. Really good for people who have blood pressure issues or metabolizing sugar issues. I'm not a doctor. Don't take my advice. Do your own research. Chelated zinc lozenges. Awesome for if you have a sore throat. I ordered a bunch of stuff from Puritan's Pride. They have good prices. You can check them out. Easy to find online. Zinc lozenges. Wonderful. More women's multivitamins. I have a couple of Israeli bandages back there. I have favorited a video on Israeli bandages. If you don't know how they work, check it out. I think I bought about 5 of them. I think they're about $7 a piece. I think they would be invaluable if you needed to stop somebody who was losing a lot of blood. Stop them from bleeding. I store some Pedialyte. I don't have any small children, but if I knew somebody who had a small child that was having diarrhea, I'd sure want to be able to help. So I store some Pedialyte. I store some children's nighttime cough and cold and children's allergy relief. So that's that drawer. Let's go down. This is an old chest, and sometimes it gets a little cranky. Okay, here's the last one. Lots of cotton balls, and I have started storing these. These are premium cotton rounds. They're really used to take off makeup. You can see them stacked up there, and I thought, boy, wouldn't that be great for wound treatment at like 1/4 of the cost of gauze pads and that kind of thing. And you might not want to lay this as right on top of the wound because, pardon me, it's not sterile. However, if you were stacking up gauze to stop bleeding, I certainly would grab some of these and use them. They'd be cleaner than an old towel or an old t-shirt you grabbed probably. So I'm storing lots of that. And then down here is also Oh, calcium. Yep, I'm older and I don't want to be all stooped over, so I do take calcium. And that's all for this little chest, and I'll take you and show you something else. All right, here's cabinet number 2, and I'm in a pretty tight space, but I'm going to see if I can get this done here. It's actually my food storage room. You'll see some hamburger helper kind of meals stacked up there. But on top of this chest, I have 2 big boxes that won't fit in the chest. One is for sterile non-adherent pads. These are the 2x3 pads. They're individually packaged. Over here, I really love this. This is 50 packets in this box of Proton Iodine Swab sticks. They come like this. If somebody gets a bad cut or whatever, something I need to clean, you just open up this. The swab stick's in there. It's already pre-moistened with Proton Iodine solution. You just clean it up and pitch it. So there's 50 of those in there. In the top, I have some, strangely enough, pardon me, this whole thing used to be filled with sewing supplies, and now there's just some scissors and a rotary cutter in the back there, and that's all that's left of my sewing supplies in here. Here is a sling, and this is a wrist support. Have all kind of support things like that. Here's a knee stabilizer and an ankle stabilizer. I think there's another wrist in the back. Then I've got bandages back here, more supports, and then I've got tapes, all kinds of tapes right here. This is super glue for healing, for closing a wound instead of stitches, if you want to do that. Here's something I highly recommend, especially if things go south and there's people traveling around that have been on the road and that kind of thing. It's Lice Treatment, and I would have some of that in my emergency stash if I were you. Okay, let me put this back in here. All right, moving on down. Here's bandage kinds of things. I have lots of butterfly closures, some Mediquick after scrapes and cuts spray, more bandages, more Band-Aids, more gauze pads. These are more sterile pads. Here's some gauze that was given to us, I think, when one of us had oral surgery or something, and the doctor put that in a bag and I just saved it in there. More gauze pads, more strips to close wounds. Next one. Okay, this one has some prescription medication in it. This is extras of prescription medication. Whenever I'm given a prescription, and sometimes, I know it's going to sound kind of crazy, but sometimes when I know I could probably get well on my own, I go ahead and go to the doctor, and if they prescribe an antibiotic and I think I can get well without it, I just stash it. So, and just store and stock up. Amoxicillin, oh, that's some really good strong ibuprofen. Some creams, especially important if you have somebody who has asthma or seasonal allergies and needs an inhalator. There it is. Here's some antibacterial spray. I've got bacitracin in there, cortisone 10 plus. Here's the triple antibiotics I bought last night. Alcohol swabs, the Aspirin. In here I've got really it's cold and flu kind of things here. I've got some more cinnamon in the back. I've got echinacea tablets here. Cranberry tablets, that's for female problems. Cayenne fruit, I take the cayenne and garlic in the winter. I'm a preschool teacher. If kids come in coughing and sneezing and croupy sound and all that, then I immediately start taking the cayenne and garlic. L-lysine, that helps if you've got mouth sores. More vitamin D, and then lots of cough drops. My favorite happens to be this Ricola. They run it on sale for 99 cents. They're usually $1.99, but they run it on sale for 99 cents at Walgreens. And every time they run it, I go pick up some of them. They're very good cough drops. More bottles here. More vitamins. The big ones are fish oil. Children's vitamins. More acidophilus in here. We already talked about that. That's adding the good flora to your intestines. More calcium. Oh, here's for you, American game fowl. Fiber capsules. Very important to have, especially if you at any time are going to be eating a diet high in dairy or meat. Okay, and down here's nose sprays, antifungal cream, more antidiarrheal, mucus relief. This is wonderful. Again, I'm not a doctor, but if I feel like I'm getting a little bit of a sinus problem, if I will go ahead and use this mucus thinner, lots of times I can keep myself from getting a full-blown sinus infection. So that's the bottom of that storage drawer, and I'll show you a couple other things in just a minute. All right, let's finish up this first aid thing. I also store some big bulk items, but I'm not going to show you all that. I've got alcohol and hydrogen peroxide and big bags of Epsom salt. They have an application for both medical and also in the garden. So I've got hydrogen peroxide, alcohol, and Epsom salt. I also have first aid kits. I keep two. One smaller one that I allow my family to get into, and one that they're not allowed to touch unless I'm dying. Because I like to know it's stocked, and you know if you've ever let your family dig in your medical supplies that when you go to look for something, sometimes it's not there. So here's the one they can get into. It's 2 layers, and then this is one, this is mine. I have used my first aid kit on many occasions. One time I had some neighbors across the street, and the little boy came running over and said, please come help, my sister has fallen and hurt herself, and it's making my mom and dad sick, and they can't help her. Well, I had 2 friends, my neighbors, who really could not, both the mother and the father, they never should have got married if they had this problem. Neither one could stand the sight of blood, and they were both sick. Well, their daughter was walking down some stairs with a glass dish to take it to the barbecue grill for her dad to barbecue, and she fell, and she cut her hand badly. And so I grabbed my kit. I knew everything was in there. I ran over and immediately began to give the child first aid. When the parents collected themselves and they could no longer see blood and she was stable, then they were able to take her to the emergency room for treatment. But I just grabbed this. I knew exactly where it was. I had everything I needed, and I went. So this is a tackle box. It has a top section that's packed with stuff, bandages, ibuprofen, Excedrin, things to clean a wound, little splints for fingers, gauze, a little tea light in case I need light and can't hold my own flashlight. I also have a light stick in here, chapsticks, that's on the top, just really quick treatment kind of things. Then inside it gets a little more serious. There's moleskin and cotton, and the bottom even more so. There's an Israeli bandage in there, and gauze, and cold packs, more big gauze pads. Anyway, lots of good stuff. But I know everything I need to administer first aid is in there. Gloves are in there. I'll show you just a couple of other things. Everybody needs to have a tooth repair kit or pain relief for tooth problems. That's an excellent thing to have, and you can just decide what you need. An eye patch is invaluable, especially if there's no doctor available and you're treating somebody who has a scratched eye or eye that needs to rest. An eye patch is good. One of these emergency survival blankets for treating shock. You can keep someone warm. One of these syringes is invaluable because it allows you to fill it with sterile water and be able to use the plunger and put some pressure behind water to wash out a wound when you don't want to go debris and picking stuff out. This really helps to have something to get a little water pressure. So I advise you have one of those. I have lots of Proton iodine solution. You saw my little swab, but this is a big bottle. If I need to really just gush this stuff in a big wound, I could. I also have staples to close a wound and staple remover. And I also have a military medical instruments and lots of different kinds of sutures. Nylon 2/0 is this one, but I've got lots of those. I have tried to educate myself on how to suture. There are lots of good videos on YouTube as to how to do that. They're very straightforward. One of them is, a whole series of them is done by an ER doctor who will teach you how to do that if you have the patience to sit and learn. My best advice to you is find out where the nurses and emergency medical people are that live around you. I have one RN that lives directly behind me, and about 3 LVNs that are within 2 blocks, and I think I could take this to any of them and say, stitch me up. You know, take them the equipment and just ask them to do it in the event of emergency. The last thing I want to address, because as I consider and ponder the life we may lead in the future, especially if it were one to involve no electricity, as I see it, the most reoccurring injury we will probably see would be burns. I recommend that everybody find an aloe vera plant, or that you have one. Mine has all these little pups. I'm about to transplant them, so I get that many more aloe vera plants. This is a wonderful thing that I found online called Burn Gel. Gel is spelled J-E-L. It comes in little individual packets. I had a pretty serious burn a couple of months ago as I was canning. My depth perception is not very good, and I actually laid my hand in boiling water and thought I was going to have some very serious burns. It was amazing what this did in just an hour for my burns. I also have other aloe vera gels, and I can show you how to do this if you would like for me to. These are handmade 100% cotton bandages. They are so superior to Ace bandage in that they have natural stretch built in because of how they were crocheted, and they can be boiled and bleached and reused over and over, and you secure them with a large safety pin. They're about 5.5, maybe 6 feet long. I don't believe in sitting idle, so this is what I do when I want to sit down and take a break. These bandages are wonderful, and I have a stash of them for my family. I think I probably have 15, and I've given them as gifts, and they are wonderful. So really consider burn care. If we have to use kerosene lanterns or kerosene heaters or propane heaters or candlelight, I think burns will be an issue. So that's all I have as far as first aid. I did not intend to make this video because I thought you might be overwhelmed, but Goosearrow showed her medical supplies, and she is well equipped and well supplied, and I thought, you know, she mentioned a couple of things that reminded me that I needed to get a couple of things, and I thought, you know, if I do the same thing, maybe it will also jog your memory and your mind as to things that you need to have in your supplies. So I hope it's given you food for thought, and if you have any questions, you can just send me a PM or leave a comment. If you want me to do a video on how to make these, it's very simple. I'd be happy to do it. That's katzcradul here saying stay the course.